Before we begin, Mr. King, um, if you're gonna be childish, brother, I'm gonna have to ask you to leave the room. Um, and that's just all I have to say about that, brother. This is a professional setting, so I ask that you please be professional if you're gonna be inside this room. So, Miss Exclusive, you asked to come in today. You came in today because you wanted to get an evaluation done on your birth control.
Yes.
Miss Exclusive,
Yes. Um,
I'm listening.
I think that the thing just broke. I think I just
I
needed
think that
surgery to
the
get it
thing just
removed.
broke. I think I just need surgery to get it removed.
Okay, that's fine. Um, Let me see your ID real quick. That way I can log you into the system. Okay, so basically you just want to get it removed today, and that's it.
Yes.
Yes.
Okay. Um. So first, I'm gonna take a couple vital signs real quick: blood pressure, heart rate, your temperature, real quick. Give me
Okay.
1 second.
Okay.
Okay. Blood pressure seems to be good. Your heart rate seems a little elevated, but I mean that's probably normal in these cases. If you believe that it is probably causing slight pain.
Where y'all at though? Where
That's
y'all at?
understandable.
At the front. Y'all at
That's
the back.
understandable.
Rodo, is you at the back end or the front? Rodo, is you at the back end or the front? All right here inside. I do not see you.
Okay, you're reading
All
a
right here
regular
inside. I
temperature.
do not see you.
Your temperature is regular. It's nothing crazy about that. Give me 1 second. Let me review your medical history real quick.
I did get lip fillers last week.
I did get lip fillers last week.
You got lip fillers
Yeah,
last week.
by the other doctor.
Yeah, by the other doctor.
Okay, I have a pretty good idea on who did that. Okay, so the recent injury that occurred with the birth control. Give me 1 second. So could you tell me on a scale from 1 to 10, how bad is the pain?
The pain is like 15.
The pain is like 15.
Oh, okay, that's pretty bad. Can you describe your symptoms and tell me how long they've been occurring as far as pain, swelling,
I have
bruising, feeling that the implant has snapped
Yeah,
or
I heard
moved?
it snap, and
Yeah,
there's a
I
lot of
heard it
bruising,
snap, and
and
there's a lot of
I can
bruising,
feel something sharp.
and I can feel something sharp.
Any numbness
It was
or
numb
tingling?
for the first
It was
20
numb
minutes.
for the first 20 minutes.
Okay. Alright, come in here for me. Let me get you to sit on the bed for me.
I got it done 2 weeks ago.
I got it done 2 weeks ago.
Okay, let me examine your arm real quick. Okay, so yes, the implant is broken. We can do I'm gonna do a quick imaging real quick. So I'm gonna do an X-ray real quick, so that way I can physically see the implant real quick.
Okay.
Okay.
Give me 1 second. Okay. All right. Let me scan the arm. Okay, give me 1 second. Okay, Miss Exclusive, can you hear me? Miss Exclusive? Okay, Miss Exclusive? Okay. So I've reviewed everything in the x-rays and stuff like that. Now I have to discuss the treatment option. I have to remove it. It is broken. So it's causing symptoms or not functioning properly. So I have to remove it. Which if you do want to get back on birth control, since this is the third visit and the last time you came, it was already moved slightly. I wouldn't recommend for me to re-implant another birth control implant today. But what I will say is we can remove this one, and then if you give it a week or two after the incision has healed, then we'll be able to go forward with doing
No, it's
another
okay. I
birth
don't need any
control
more
implant.
birth control.
No,
I broke up with
it's
my
okay. I don't
boyfriend.
need any more birth control. I broke up with my boyfriend.
Okay, so real quick, I'm just gonna explain a couple things like risks and benefits for the removal, and then once I explain it to you, you can give me your consent to go ahead with the procedure, and then we can get
Yes,
started.
and
Is that
will
fine?
my ass get flat because I'm not taking
Yes,
the birth
and
control anymore?
will my ass get flat because I'm not taking the birth control anymore?
Never
One more
mind.
time.
Never mind.
If you said what I thought you said, then no, it won't affect that at all.
Okay.
Okay.
So real quick, a couple benefits of the removal: it will relieve the symptoms. If the implant is causing pain, discomfort, irritation, removing it will help. When removing a damaged implant, if the implant is broken or no longer in the correct position, removal can prevent further issues. It allows replacement if the patient wants to continue using the implant for birth control. A new one can often be inserted after the old one is removed, but in this case, you said that you don't want that, so that's fine. And it stops hormone release, which if the patient no longer wants hormonal birth control or is having side effects, removal ends hormonal exposure from the implant. Risks of removal is bruising. Mild bruising around the incision site is common. Bleeding, a small amount of bleeding can occur during or after the procedure. Pain or soreness, the area may be tender for a few days. Infection, any procedure that involves an incision carries a small risk of infection. Scarring, a small scar may remain where the implant was removed. And difficulty removing the implant, if the implant is deep, has broken into pieces, or is close to nerves or blood vessels, removal can take longer or may require referral to a clinician with an additional expertise. But I can handle everything today. Nerve or blood vessel injury. This is uncommon but can happen if the implant is located near structures in the arm. Do you have any questions?
No, I don't have any questions.
No, I don't have any questions.
Okay. So I have your consent to go ahead and go through with the
Yes,
procedure?
please remove it right away.
Yes, please remove it right away.
Okay, I will. Okay. Okay, successfully able to remove all the pieces. Everything is wrapped up. Everything is done. I just want to give you a couple aftercare instructions. I just want you to keep the area clean and dry. Leave the pressure bandage on as directed.
You
Avoid
didn't
heavy
hurt me
lifting
this
for a
time.
short period.
You didn't hurt me this time.
I know. Everything, everything went through smoothly. Everything was pretty good when it comes to incisions and things like that. I'm a little bit more steady-handed too. But I will explain to you a couple warning signs that you should look out for, which is increasing pain, redness or pus, fever, significant swelling, numbness, or worsening arm symptoms. But you shouldn't be having any of those type of symptoms. Through anything though, do you have any questions?
No questions.
No questions.
Okay. So I want to discuss a follow-up appointment. Just for you to come back so I can check on the incision and stuff like that in 2 weeks, making sure that it is healed properly. I am going to give you your discharge papers and things like that, so could you come with me and just sit real quick for a second on the couch for me? Okay, real quick. Could you hand me your debit card real quick? That way I can try to run through your insurance.
Damn, not the insurance.
Damn, not the insurance.
Yes, ma'am. Yeah, it's procedure. I gotta run your insurance card.
How the hell do I do that?
How the hell do I do that?
Just hand me your card.
It looks though.
You can hand me. Yeah, that'll work. Okay. Insurance and everything came back good. Okay, Miss Exclusive. You are free to go, but I would like to see you for a follow-up in 2 weeks. Please see the front desk for your next appointment, discharge paper, and take-home medications. I prescribed you a couple pain medications just for the moment. Just to make sure you take those regularly as the time is prescribed on the bottle.
With no alcohol or with
just to
alcohol?
keep up the pain within
With
your
no
arm.
alcohol or with alcohol?
No alcohol, Miss Exclusive.
Okay.
Promise me you aren't going to be out there drinking any alcohol. You won't be able to, at least not while you're taking the medication. If it's not bothering you too bad and it doesn't hurt, you just need to take the medication as needed when you're hurting. But if it's not hurting, then you don't have to take the medication. But, just make sure you're not mixing alcohol
Can I
with
still smoke
the
my weed?
medication.
Can I still smoke my weed?
As long as you're not mixing it with the medication, that's fine.
Okay.
Okay.
Yes, ma'am. If you're taking the medication due to pain, just make sure during those hours you're not smoking or drinking. If you don't need the medication and it's not bothering you, then feel free to, do whatever it is that you need to do.
Okay.
Okay, again, thank you so much for coming down, Miss Exclusive. Thank you for coming with her, Mr. King. I look forward to seeing you again in 2 weeks,
Thank
Miss
you.
Exclusive.
Thank you.